Welcome to the 5-Minute Med Student. Today's topic is pulmonary function tests. There are three main types of pulmonary function testing. There is spirometry, full-body plasmography, and single-breath diffusing capacity. Spirometry is the most cost-effective and measures most functional lung volumes and can be done in most office settings. Full-body plasmography requires a sealed chamber, is more expensive but allows for the most accurate measurements of known lung parameters. Single-breath diffusing capacity is a measurement of the health and function of the alveoli. Important definitions of lung function parameters include total lung capacity, which is the total volume that the lungs can hold, forced vital capacity, which is the maximum in and out. Maximum inhalation after maximum exhalation is forced vital capacity. Residual volume is the volume in the lungs that cannot be physiologically exhaled, so it's the volume that's always present. Tidal volume is the air volume exchanged in a normal inhalation-exhalation cycle. Spirometry-specific parameters include the peak expiratory flow, which is the maximum rate of airflow during forced exhalation. So peak expiratory flow is the maximum rate of airflow during forced exhalation. And also forced expiratory volume in 1 second, or FEV1, is the volume of air exhaled within the first second of forced exhalation. So peak expiratory flow is the maximum rate of airflow during forced exhalation, and forced expiratory volume in 1 second is the volume of air exhaled within the first second of forced exhalation. A commonly used diagnostic parameter is the forced expiratory volume in 1 second to forced vital capacity ratio, or the FEV1 to FVC ratio. This is a measurement of how much volume is exhaled in the first second of exhalation as compared to the total volume of air that can be exhaled. Hence, it is called the FEV1 to FVC ratio. A low FEV1 to FVC ratio means that the amount of air that is exhaled in the first second is low compared to the total air that can be exhaled. This goes with classic obstructive lung diseases such as COPD and asthma. In obstructive lung diseases, the airways are narrowed or obstructed, so total lung volumes increase due to air trapping. The flow volume loops shift left, and there is a low FEV1 to FVC ratio. A normal to high FEV1 to FVC ratio means that the amount of air that is exhaled in the first second is normal to high compared to the total air that can be exhaled. This goes with restrictive lung diseases in which lung expansion is impaired. In restrictive lung diseases, the lungs cannot expand, total lung volumes decrease, and the flow volume loops shift right, and the FEV1 to FVC ratio is high to normal. In summary, in obstructive lung disease, FEV1 FVC ratio is low because exhalation is difficult due to airway narrowing. Total lung capacity increases due to impaired exhalation. FEV1 is low. In restrictive lung disease, FEV1 to FVC ratio is normal to high because the problem is with inhalation. Total lung capacity decreases. Forced vital capacity is low. Thank you for listening to this episode of the 5-Minute Med Student.